welcome. My name is Dr. Calliope. I'm going to be performing your examination today. How are you doing today? Yeah, it's much more mild weather out there, isn't it? A lot better than what we had. So, let me get my clipboard real quick. Alright, let's see. Can I get your name for me? And your date of birth. Very good. So it looks like today we have a respiratory examination for you. Is there any particular reason that you wanted us to do this examination today? Okay, wonderful. So before we begin, I'm going to ask you a few questions if you don't mind. Nothing too invasive. Do you have any current pain or illness right at the moment? Okay. And any changes to your medical history since I last saw you? Good. And what about your family history? Okay. Good to hear. And any new allergies at all? Okay. And any changes to your medication list? Okay, wonderful. So, for our respiratory examination today, we're going to, of course, assess the different parts of the respiratory system, which is primarily going to be your lungs, right? We're just going to make sure that you're getting enough oxygen to your body, you're not having any coughing, shortness of breath, wheezing, any issues with asthma, COPD, anything like that, right? Have you had any trouble with any respiratory illnesses in the past? Okay. And I assume no surgeries to alleviate said symptoms or conditions, right? Okay, very good. So this examination is going to involve me inspecting you, of course, inspecting your hands, your chest, your back, your face a little bit, and nothing should be too discomfortable. But please let me know if it is at all or if you're experiencing any pain so we can stop, okay? Right. Do I have your consent to touch you and to treat you today? Okay, that's wonderful. So before we begin, I just want to say that it's a little busy in the neighborhood as far as yard work is concerned. So it might be a little noisy from time to time. I do apologize. Not too much I can do about it though, so we'll just ignore it for now, okay? Okay, great. So, let's see. I'm gonna first take a step back and I just want to look at you as a whole. I'm just going to look at your face, of course, just around your body. No aids or anything. And I'm not seeing any signs of cyanosis, no pallor issues, and I haven't noticed you having a cough or any wheezing or any issues like that so far. So, and you don't seem to be short of breath, seem to be breathing quite normally, is that correct? Okay, that's great to hear. So, I'm just going to note that real quick, and then we're going to start in on inspecting your hands. Okay. So, firstly, I just want you to go ahead and hold out your hands for me, okay? Hold out your arms. hold out your hands, and I just want to take a look at your hands, and just going to be looking for any color issues, skin changes, tar staining. You don't smoke, right? Okay, that's what it looks like. Good. Okay, and just check the other hand real quick. Alright, that all looks quite good. Now, I'm going to have you do a little test for me. I want you to put your index fingers back to back here, and I just want to look in that little window right between your fingers. Good, no issues with any clubbing there. Great. So now I'm going to have you hold out your arms for me, okay? Hold them out, palms to the floor, okay? I'm just going to watch here. Okay, that's great. No issues of any fine tremor. So now while I have you have your hands out, I'm going to have you cock your wrists back, okay, so that your fingertips are pointing to the ceiling, okay? We're just going to hold this position for just a titch, okay? Good, that looks great. You can go ahead and put your hands down there, so no issues with any flapping tremor. If you have an issue with carbon dioxide retention, sometimes you can see that your hands kind of flap around, which didn't have any evidence of that. So I'm going to have you hold out your hands once more, and I'm just going to be just assessing the temperature difference between your arms, your hands, one versus the other, okay? I'm just going to come in and lightly just lay backs of my fingers on your arms and your hands. Okay, that looks great. No issues with temperature. Your skin is warm to the touch. I'm just going to note that real quick, and then we're going to grab your pulse. Alrighty, so is there a arm that you're more comfortable with me taking your pulse with? Okay, so I'm just going to have you lay your arm down and relax. I'm just going to put my first two fingers right at the base of your thumb and just feel your pulse. We're going to wait here for a little bit while I just assess your pulse. So, a good pulse, and your respiratory rate is normal as well. There we go. Okay. Now I want to check your jugular venous pressure. So I'm going to have you tilt your head to the left, okay? Just tilt your head to the left. Very good. I'm going to come in a little closer, and I'm just going to be watching the area right by your sternocleidomastoid, right on your neck, right in this area. And I'm just going to watch here for just a little bit. Very good. Very good. Now, do you have any pain in your stomach area at all? Okay, good. So I'm going to have you keep your head tilted to the left, and I'm going to press quite firmly on your liver, okay? I'm going to watch that same area near your sternocleidomastoid. We'll just see if there's any issues with any reflux, okay? Okay, so keep your head to the left, and I'm just going to press quite firmly on your liver and just watch right here for any reflux issues at all. Okay, looking good, okay. All right, you can go ahead and put your head back in a more neutral position. Just going to note that real quick. No issues there at all. So now I want to take a look at your face, okay? So I'm just going to look at it a little closer here now that I'm a little closer. And just noting any pallor issues or any skin coloration issues, cyanosis and whatnot. Okay, very good. Now I want to check your conjunctiva for any anemia issues, any pallor issues. So I'm going to be pulling down on your eyelids. I want you to look upwards for me, okay? Come in quite close. I'm just going to pull down. Okay, and back. We're all good there. Looks great. So I just want to take a look inside your mouth real quick. Would you mind just opening your mouth for me? Okay, good. Now, just looking for any cyanosis or any oral fungal infections, which one can get when using, for example, like an inhaler for a long period of time. Okay, that looks good. Would you mind lifting your tongue to the roof of your mouth? Good, thank you. Okay, you can put your tongue down and close your mouth. So this next part, I'm going to be actually inspecting the chest wall, okay? So first I'm going to just stand back here and I'm going to just inspect for any scars or any deformities. You did tell me that you haven't had any surgeries for any issues regarding the chest or anything housed within. But I just want to double check here. Would you mind just lifting your right elbow for me? Good. And then you can put that down, lift your left elbow for me. Okay, very good. That all looks great. Let me go ahead and make a note of that. Okay, I'm just going to get a little closer and look for any deformities in the chest wall, anything sunken in, hyperinflated, anything of that sort. Okay, that looks great. Alright, now I'm going to be just inspecting the trachea, and I will be palpating it a little bit. This might be a little uncomfortable, just so you know. I will do my best to be very gentle, however. So I just want to check the tracheal position here. Make sure that it's in the middle and isn't deviated at all. Now I'm going to be testing the cricosternal distance. And so I'm just going to be placing my fingers right about here. Let's see, it's about 3 fingers apart there. That's very good. That's normal. Okay. Now we're going to be getting into some palpation of the chest. First, I'm going to palpate your apex beat, okay? So that's going to be on the mid-clavicular line and the 5th intercostal space. There we go. Just going to be pressing my hand there. Good. That's very good. Now I'm going to be assessing your chest expansion, how much your chest expands when you breathe. So I'm going to be wrapping my hands quite tightly around your chest, and when you breathe in, of course, my hands should come apart, and they should be symmetrical when they come apart. And when you breathe out, then they'll come back together, okay? So I'm just going to wrap my hands around your chest here. I want you to take a deep breath in for me. Deep breath out. Deep breath in. Deep breath out. Very good. Okay, that was symmetrical and even. Right, I'm going to take a note of that. Okay, now we're going to be doing some percussion, and I'm just going to be tapping on your chest in different areas to just assess if there's anything that shouldn't be there. So it'll just give us a little bit of a resonant tone, and from that tone I can determine what's going on the inside. Yeah, it's pretty interesting, really. So we're going to start in, and I'm just going to be putting my hand on your chest and just tapping. So supraclavicular, supraclavicular, infraclavicular, infraclavicular, along the chest wall. Good, okay, and the axilla here. Okay, very good. So, now I'm going to be auscultating your chest. We'll grab the stethoscope real quick. And I'm going to be listening to your chest and the different parts that I just percussed, okay? So, I just want you to breathe normally for me, okay? I'm just going to take a listen here at the supraclavicular area here. Okay. Supraclavicular. Okay. Infraclavicular. Infraclavicular. Okay. And along the chest wall here. And just on the sides here, the axilla. Okay, very good. So now I'm going to be testing the vocal resonance. So I'm going to be putting my stethoscope on your chest, and every time you feel the stethoscope on your chest, I want you to say 99, okay? Alright, so here, 99. Okay, 99. 99. Good. 99. 99. 99. 99. 99. 99. 99. 99 and 99. Good. Okay. That sounded very good. So I'm going to put this down for a second. We'll be bringing it back out when we do our posterior chest assessment. But for right now, I'm going to be just coming behind you, and I'm going to be just assessing your lymph nodes, okay? So this will be all around your chin, your neck, a little bit along your clavicle, okay? Alright, shouldn't be painful at all. It will be very gentle. Okay? Very good. So I'm going to go behind you real quick. Okay? Alrighty then. So, just going to be palpating firstly underneath your chin for the submental lymph nodes. And then moving on to the submandibular lymph nodes, then the preauricular lymph nodes here, and the postauricular lymph nodes, then our superficial cervical, deep cervical here, okay, and your posterior cervical, and the supraclavicular right over just along your clavicle. Okay, very good. I'm going to come back around, okay? Alrighty. So I didn't find any issues there. Your lymph nodes are all looking pretty great. So now we're going to grab my stethoscope again, and I will be going to your back, okay? So all of the different assessments that we did with your chest wall on your front here, we're going to do now to the back. So I'm going to be inspecting, I'll be percussing, auscultating, we'll do some more vocal resonance, checking your chest expansion, okay? I'm just going to be doing this all behind you, okay? But I'll let you know what I'm doing so that you don't get freaked out or anything, okay? Okay, very good. Just going to come around here. So now we're going to do the posterior chest assessment. I'm going to have you cross your arms in front of your chest so that each hand is on the opposite shoulder, okay? Very good. So I'm just going to take a look at the chest wall and inspect for any deformities, any scars, and whatnot, okay? Alrighty, now I'm going to be testing for chest expansion again, remember? So I'm just going to put my arms or my hands around your back, and I want you to take a deep breath in for me, okay? Deep breath in and out. Deep breath in and out. Deep breath in and out. Very good, okay? So now I'm going to be percussing along the chest, okay? So I'm just going to be tapping on 8 different points along your chest, okay? 4 on each side. So 1, 2, 3, 4, 5, 6, 7, 8. There we go. Now I'm going to be putting the stethoscope on, and then we're going to be listening to different parts in your back, okay? So I'm just going to be pressing my stethoscope to your back. I want you to take a deep breath in for me. And out. Deep breath in. 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 And out. Deep breath in and out. Deep breath in and out. And lastly, deep breath in and out. Good. You're doing really well. So now I'm going to be testing the vocal resonance in your back. So every time the stethoscope touches your chest, I want you to say 99, okay? Alright, so first, 99, 99, 99, 99, 99, 99, 99, 99. Okay, very good. And while I'm back here, I'm just going to be putting my fingers at your lower back and checking for any sacral edema, okay? Okay, that looks good. So I'm going to come back around now. Okay, that all looked very good. I'm very pleased with all of that. So I'm going to put this down. We are almost done. So I'm just going to check your calves here real quick for any signs of any deep vein thrombosis, okay? Okay, and I'm going to be palpating your ankles and just testing for any pedal edema, okay? Okay, that looks very good. So, I'm just going to make a few notes here. And I think that we are all finished. I am very pleased with our examination, and you did really well for me. I appreciate that quite a bit. So I do not think we have to do any follow-up tests, and you can leave here with a clean bill of health. Okay? Okay. Do you have any questions for me at all? Okay. Very good. Thank you so much for coming in to see me today. I hope you have a whale of a day and a good rest of your night, okay? Okay. Thank you.